Hello everyone, how's it going? Have you ever experienced vertigo? Well, what is vertigo? What is the most common cause of vertigo? What are some things that can be done to alleviate the symptoms? And when is it time to go to the emergency room? Well, if that sounds interesting to you, then keep watching. Now, vertigo is not a disease itself, but it can be a symptom of various health conditions. Experiencing vertigo is not really the same thing as lightheaded. When you feel lightheaded, when someone has vertigo, they actually feel as though they are spinning or moving, or that the world around them is spinning. Someone I know recently experienced vertigo, and I was actually really surprised at what her doctor was able to do to help her. But we'll get to that in a bit. Now let's talk about some of the symptoms and the problems it could cause. So one of the symptoms may be problem focusing the eyes, dizziness, hearing loss in one or both ears, a loss of balance which could lead to falls, ringing in the ears, nausea and vomiting which could lead to a loss of fluids, and headaches. So what is the most common cause of vertigo? Well, that would be inner ear problems. Tiny calcium crystals in the inner ear actually move where they shouldn't. Surprisingly, this can actually occur when someone does something as simple as rolling or turning in bed, looking up, bending down, or if someone gets hit in the head. Having a viral infection could also lead to vertigo. It could actually cause a problem with the inner ear by affecting the nerve that controls balance, and that can cause sudden, intense vertigo that can last for hours or days. Meniere's disease can cause fluid to build up in the ear. That could cause episodes of vertigo that could last for hours. So some of the other things that could possibly cause vertigo would be a drop in blood pressure, heart rhythm problems, or maybe even poor blood flow. Certain medications may even cause this. Some antibiotics, some anti-inflammatory medications, some cardiovascular drugs, sedatives, and even some antidepressants. Other possible causes would be a head injury, prolonged bed rest, ear surgery, or if someone gets shingles near the ear, low blood sugar, anemia, anxiety and panic attacks, carbon monoxide poisoning, or dehydration. So what can be done to alleviate some of these symptoms, and when would it be time to go to the emergency room? Well, we'll get to that in a moment, but first, some reminders. I'd like to remind you to please like and subscribe if you're enjoying today's information. Also, a reminder to check out the description box below. You can check out the links to see where I gathered the information for the video, and then feel free to leave a comment below if there's something you'd like to share on this topic. Okay, so how can you ease your symptoms? Well, it may help if you lay down in a dark, quiet room. You can try sleeping with your head elevated with 2 pillows. When you're standing up or you're going to turn your head, you want to do that very slowly. Also, if you feel dizzy, it may be best to sit down for a while. You want to try to squat down instead of bending over if you go to pick something up. And it might be safer if you can turn the lights on if you're getting up at night. And maybe even use a cane or a walker if you really feel like you might fall. Now, doing these things may help somewhat, but it may not be possible to get rid of vertigo without the help of a healthcare provider. So if you experience repeated, sudden, severe, or long-lasting vertigo with no clear cause, it's best to consult a physician. Now, being dizzy is rarely life-threatening, but if you experience the following symptoms, you should go to the emergency room. Sudden, severe headache, trouble walking, weakness in the face or arm or leg, vision changes, chest pain, heart palpitations, confusion, slurred speech, ongoing vomiting, a fever over 100.4 degrees Fahrenheit. And if you're experiencing any of these, you don't want to drive yourself. Make sure you call 911. Now, if the vertigo is due to a problem with the brain, a person may experience difficulty swallowing, double vision, eye movement problems, facial paralysis, slurred speech, and weakness in the limbs. A person may experience vertigo due to a migraine, a stroke, a TIA, multiple sclerosis, or other neurological conditions. However, these are less common. So what kind of treatment is available? Well, I was surprised to learn that repositioning maneuvers can actually help with the problem if it's an inner ear problem. And this can be done in the doctor's office. They can do it right there. They can even teach you how to do it at home. There's also some certain medications that can help with vertigo, and you can actually go to physical therapy and learn specific exercises for vertigo. Now, even though it's rare, if someone has, if they had a brain tumor or neck injury, that may require surgery. But it's much less common for someone to have vertigo because of a brain or nervous system issue. But even if someone's having the issue because they have an inner ear problem, which is the most common, it can cause some serious injuries if it's left untreated. Sometimes the body will adapt within a few weeks, but it may not be possible for it to go away on its own. It could actually cause falls, which could lead to fractures and other injuries. It could affect a person's quality of life, and it may even affect their ability to go to work or to drive. So you want to keep in mind that if you have repeated, sudden, severe, or long-lasting vertigo with no clear cause, it's actually best to speak to your doctor about that. But it may be, a simple cure. It may be just something with some head movements to help get those calcium crystals back to where they belong. Well, I hope something in this video will have helped you, and I hope to see you in the next video, where we'll discuss another way we can improve our health. Hello everyone, how's it going? Have you ever experienced vertigo? Well, what is vertigo? What is the most common cause? And what can be done to alleviate, okay, I guess I'm gonna start over. Now, what is the most, I think I'm gonna start over. And this can cause sudden, intense vertigo that actually can last days, maybe hours, but also, oh my goodness,